Marjorie, thank you for accepting my invitation.
Thank you.
I was looking forward for this conversation. So you are a developmental psychologist.
Mhm.
Where are you working nowadays?
I work at Calvin University in Grand Rapids, Michigan.
And you researched international adoption.
I have
And,
done some of that.
and I think one of the things that you researched that got you some stardom was smacking.
Yes. Where are you coming from, Rod? From the United States or
I'm Brazilian.
Brazilian? Okay. Yeah, there's just always these little language differences where in the United States we usually say spanking, and then in Europe and much of England, etc. They will often say spanking, and so I'm never really sure which audience, but I think your audience is international. Is that correct?
Yes, to some extent. And of course, I really usually don't put too much emphasis on the word choice because I think there's a,
Okay.
there's a bit of a dictatorship going in that regard. We'll,
Okay.
we'll trust the semantics.
Okay.
So you did some of that research, and I think that I think that got you some expression in terms of because that's a very controversial topic.
Yeah, that was really kind of funny. I never set out to be a spanking researcher in any way. I was working at a company called Child Trends in Washington, D.C., and sometimes the government is a little bit slow. And the grant that I was working on stalled a bit, and my boss said, "Hey, you have to charge your hours to something. We have some funding for this. Would you like to do something on discipline?" And I said, okay, I have to charge my hours to something. And so, yes, I was really just amazed when I jumped into that research because things were based on, simple correlations. Things were not very sophisticated. And so I thought, well, these must be people who don't really understand sophisticated research. So I went to a conference thinking people would be really glad to hear that if you control for prior levels of child adjustment, spanking doesn't predict very much. And I actually had quite a hostile audience. It was my introduction to figuring out that as a young researcher, that science is in fact not entirely value neutral. So, yeah, so I published a few articles, and yeah, they were picked up by U.S. News and World Report, New York Times over different kinds of articles. So that has just been not something I meant to get into, but I stay in it because I get so frustrated at the simplicity with which people are willing to say, oh, spanking clearly causes so many negative problems. And a lot of those claims are really just based on bivariate correlations. So if you look, for example, at the APA statement, it's based on a meta-analysis that is just simple bivariate correlations, which to me is just really not ethical. So
Can
yeah.
can you explain that concept of bivariate
Sure, absolutely.
correlation?
Yeah, so a correlation just means that that if you have sort of raised rates of one things, you're going to have raised rates of the other, or the reverse. So when we talk about bivariate correlations with respect to spanking or smacking, it simply is saying kids who are spanked more have higher rates of behavior problems. So if you are, not a very savvy researcher, you say, oh, well, this must mean that spanking is causing the behavior problems. But most people, even if they don't, understand a lot about statistics, have probably heard the phrase correlation does not equal causation. And, certainly when we think about a correlation, we have to think about many directions of effect. So it may be that spanking is causing behavior problems. It may be that behavior problems is eliciting the spanking. And probably there's some amount of bidirectionality. But nobody should be, making statements that spanking causes behavior problems simply on the basis of a correlation. And so this is just really, I think, a disgrace that the APA is basing so much of their evidence on work that is, just a simple correlation.
Yeah, one would expect that science would influence ideology, but it's the other way around. Ideology really
Yeah.
is polluting a lot of what we do nowadays.
Yeah.
But so psychology has been talking about parenting for more than
Hmm.
100 years. Freud was
Hmm.
talking about trauma in
Yep.
childhood and raising. Uh, when did psychology or psychologists started to actually sort of systematically, like with a more scientific approach, look
Mhm.
into parenting styles?
Yeah. I think most of us who study parenting date that in about the 1960s with the work of Diana Bauman. So if you think about where the world was in the 1950s, we were coming off of World War II. And the whole world was really, I think, quite rattled to realize that obedience was not necessarily good. Many traditions really emphasized the importance of obedience, whether that was cultural, whether that was religious. And so when we saw that horrific things could be done in the name of obedience, the whole culture in many, at least in the United States, went in a quite different direction. So you had the hippies, you had people riding around in their Volkswagen buses, throwing off authority. And so a woman named Diana Bauman, who was a researcher at Berkeley, said, I think we ought not go too far in the other direction by becoming so laissez-faire that our children don't learn that they need to control themselves. So she began at that point. She did a study, it's a pretty famous study of preschoolers, and she followed them until the time they were adolescents to see if the parenting that they received as preschoolers, how it predicted their outcome as adolescents. So, and she found that basically, probably the two most important things to look at in terms of parenting are the level of warmth, support, and then the level of kind of maturity demand. So, not heavy handed control necessarily, but when you set a maturity demand, do you make sure that the child meets that demand? And has consequences if they don't. So, kind of a warmth control, or you could say support standards, however you want to put it. But she found that if those were very important dimensions, and parents could be high on both, or high on just one of them, or low on both of them. And so she developed what we think of as parenting styles. And we generally say that authoritative parenting, which is when you are high on both of those things, that is generally associated with the best child outcomes.
So authoritative would be like because I gotta translate these things. You
Yeah,
gotta emotionally available to the kid, but you also firm with expectations and whatever consequences are agreed upon, kind of thing. And,
absolutely.
is that model still used?
Yes, sort of. So, and I should, just to be fair to what I said previously about correlations, we have to assume that we can't assume that it's all parent to child direction, because obviously parents are also responding to their children. It's easier to be warmth and supportive with a, compliant child, and to be, set standards when the child doesn't completely throw a fit and give you a lot of problems back. So we do have to think about bidirectionality here. But yes, we generally use that model, or at least we use those words. So what has happened is that most of developmental psychology said, oh, authoritative parenting, everybody knew that was the best kind, and that's been replicated in just hundreds and hundreds of studies. So everybody knew it was the best kind. But then as the culture has changed a little bit, and things like spanking, for example, have become a little bit more taboo, psychologists started making claims that were actually not what Diana Bauman said. So they started writing things like, well, authoritative parents are very warm and supportive, and they almost never use physical discipline. And, Diana Bauman was, while she was still alive, was then writing things back like saying, I never said that. In fact, most of the parents, and in the 1960s, all of the parents that she had labeled authoritative in the best group, in fact, did use a little bit of spanking when their children were preschoolers. So people kind of co-opted the name authoritative parenting. And now, sort of whatever parenting you think is best sometimes gets called authoritative. But, that's not really fair to Bauman. It's not really a good representation. So we use the words, but sometimes they don't mean the same thing to all people anymore. So we've really moved toward, culture has kind of moved towards this positive parenting movement where you only use warmth and support. And that's really not the model that Bauman gave us, even though sometimes people will still call that authoritative.
And that's one of the things I wanted to ask you is that I saw one of your papers about timeout, and there was this back and forth discussion about it, and I think one of the things that you pointed was this exclusive positive parenting, um,
Yeah.
which is this because we see I'm going to hold back my criticism, but um, and I saw, so there's this paper called "It's Time for a Time In," like sort of saying time out is this terrible thing. And how do we have the data supports that, or again we're talking about this influence of ideology in science as opposed to the other way around?
Yeah, I think that there's a group of scientists, and I don't want to, completely disparage them because ideology does impact what we do. And I think that the group that really wants to give no consequences to children have good intentions. They are certainly concerned with like spanking not spiraling into physical abuse. So I want to credit them with that. I think they really believe that there should be very little consequences for children. But what generally has happened is that they will look at programs, for example, where you teach parents to pay attention to their kids. So a program might start out where you spend 10 minutes with your child, and all you do is make sure that you're just watching them, and you say, "Oh, now you're playing with the green doll," and you just it's clear that they're getting your full attention. And so or you speak to them about, you reason with them, you do various things that are very positive. And we find that parents in these programs who are taught these positive techniques do, in fact, tend to improve their parenting and have kids who improve on, behavior symptoms they might be showing. The problem is we don't really have any data, hardly at all, that suggests that if that's the only thing you do, that's sufficient. So people have really said, oh, it's good, so we're going to say this is what you should do, but they kind of ignore, research that also suggests that consequences can also play a very important part in parenting.
That's very interesting. I always had this take on. I was trained in psychology before I went to medical school in Brazil, and in Brazil we have this still, I believe, still that was freaking 20 years ago, but we had this very strong theoretical take on psychology. So if you're learning psychoanalysis and you like Freud, you have to take all the tests and pass them anyways.
Okay.
But you don't really fraternize with behaviorists and vice versa, right?
Right.
It's this very
Yeah.
intense, and that's probably most of the learning was done based on those discussions where you say, "Oh, you guys, it's not a scientist," and they say, "And yours good with rats," and you got to come up with actual arguments, and that was a very rich experience. But later, I started to look into psychoanalysis, and because after all, they were looking to the human phenomena, and one of the things that I always thought was, what is this castration about? What is this thing about learning limits? And it occurred to me that every kid seems to have a need to, which is from an evolutionary perspective, maybe survival. There's a need to know your limits. You need to know
Right.
how fast you are, how far you can jump, how tall you can fall, from what kind of height you can fall. Um, and you also seem to do that from a social perspective.
Right.
And that's why I'm so skeptical with this idea that a parent, just an exclusive positive parenting, would actually cut the need, because I cannot see it as not being a need to say, okay, there's a limit that I can go as far as people in terms of, because I don't see a problem in saying there is a testing of people's limits, the same way that we test the limits of our reality, as every boy or girl want to know how fast, how far they can throw something. It's really a survival skill at the end of the day. And it comes to society and social interactions. Also turns out to be a valuable skill to
Yeah.
know how far you can push, and no, you're never going to learn that in a sense because
Right.
your parent is this super collected person. The other thought I had was, because a lot of these things come from personal experiences, maybe with exception of psychiatry. To give you one example, if I read to you an inventory of bipolar symptoms, in mania symptoms in childhood, it describes a normal kid. He's
Okay.
a bit of a bratty, kind of an earthquakey kind of kid, but is still,
Right.
nothing really out of the ordinary. And is used to grade and give diagnosis of bipolar to children that will then receive medications like Risperdal and things like that. Um, but a lot of people seem to take those experiences, those positions from their personal experiences, and we know that some kids are just naturally cooler than others that are like all over the place.
Mm-hmm.
Does that ring a bell? Does that make sense to you? Those thoughts?
Individual differences, or let's talk a little bit about the limit setting. Um, so I think I actually am kind of an eclectic, psychologist. I'll take from behaviorists, I'll take from psychodynamic theorists, whoever, seems to fit the situation best. But I am pretty big on some psychoanalytic and psychodynamic theorists like Erickson and Bowlby, who I kind of put in that camp, an extension of that. But so I'm a big fan of Erickson. And I think Erickson is really helpful by emphasizing that children are wrestling with things at different stages of their life. So Erickson talked about crisis. He said the crisis is the thing that the child is devoting the most psychological attention to in terms of figuring out who they are, exactly as you said. So if you think about Erickson's stages, he says from 0 to 18 months, it's kind of a pre-stage. They haven't quite figured out that they are a self, even. So, like children under 18 months don't recognize themselves in the mirror. They don't have any concept of, actually being a self. And so for them, absolutely the most important thing is to do exclusively positive parenting, be a supportive place so your child, learns to trust you, learns to look towards you, wanting to be like you, wanting to follow you as a role model, all of those kinds of things. But when we get to about 18 months, something really, really important happens in terms of kids' development, where they do start to think about who they are as a person in a very limited way already by 18 months. And so Erickson says that the crisis for 18 months to 3 years old is what he calls autonomy. And autonomy really means, am I in control of my body? Now, that doesn't just mean like, is somebody else not in control of my body? Is it me versus somebody else? Am I in control? So if I see a cookie and I'm told not to take the cookie, do I have the grit, the self-control to pull back my hand? I'm really wrestling with, am I able to keep my body from doing things I'm told not to do? So that piece that you said about limit setting is just incredibly important. If you think about Erickson, he says, for a year and a half, that is the child's main thing they're wrestling with is, can I make my body stop when someone tells me to stop? Or am I out of control, unregulated? And so that is where I think by about 18 months, parents have to be really, really conscious of saying, my kid is not going to be able to do this on their own. They need external limits enforced by me, the parent, to help them learn in small ways that they have the capacity to control their body and not run when they're told not to run. And so the fact that is, that Erickson puts so much emphasis on that being really the primary thing they're wrestling with, I think, helps us realize that exclusively positive parenting is really, I think, being negligent. We all of us live in a world where there are consequences. If I drive 100 miles an hour, I should have consequences, and if we teach our young children that in fact there are no consequences, we're lying to them about the world that they're living in, and that they will live in once they kind of move out of our protected house. So yes, I think limit settings is an incredibly important concept to start at about 18 months.
Would you say there is a blurring of that with exclusive positive parenting, or they are proposing a sort of some more smoother way of actually imposing those limits? In a perfect world where we can actually
Yeah,
dialogue with.
yeah. Well, I think my general philosophy of parenting is that you always use the least dangerous tool. So if I can accomplish something with reasoning and appealing to my child's empathy for other children, let's not hurt other children, absolutely, that is the thing I should do. But if in fact, there's no danger in reasoning and eliciting empathy, those kinds of things. But if that does not work, then I need to move to a little bit more potentially risky tool. So some people will say, giving consequences, particularly physical discipline, can spiral out of control. But it may be that is the little bit more intense tool that a particular child, and I don't want to say every child. So, I've raised some of my children without physical discipline, so not every child needs that, but for some children, that you may, in fact, have to try a variety of tools. We certainly say reason first. If reasoning doesn't work, then you try something like timeout. If a child doesn't stay in timeout and refuses to comply, then you may need to move to some sort of physical discipline consequences. So actually, in the 1960s to about the 1990s in the United States, when people were doing when children were referred for oppositional defiance kinds of disorders, and they did parent behavioral training programs, they were very heavily based on timeout. If your child doesn't comply, you put them in timeout. But if they don't stay in timeout, it was a very clear protocol where you would say, you didn't stay in the chair, now you're going to get 2 swats, and you return them to the chair. And that helps the child learn that component of self-control that we all desperately need. The child says, okay, this is a very real, consistently applied consequence. I can control my body by sitting in the chair for 2 minutes like I'm told, or someone else is, going to take control. And so so often it's kind of odd now that we're so anti-spanking, when in fact for 30 years, when we had pretty good success rates with those kinds of programs for 30 years, psychiatrists and psychologists were teaching parents, this is in fact what you should do.
Very
So
interesting. And
yeah, very interesting how the times have changed.
well, and I because of my field, I can clearly see where some of the forces come from, even without including, because usually I don't talk politics in the field, because I think we're just, everybody seems to be losing their minds these days, and
Yeah.
we are just not allowed to talk about things anymore. So I never, and I ask all my folks that I interview, I say, please don't talk politics, because it should be the other way around. Our thinking, our logic, data should be influencing the things that we think. Anyways, but I don't want to repeat myself. How are the parenting styles measured? How do we collect that data?
Sure. Unfortunately, most of it is self-report, and most of the existing measures use a lot of items. So it may be 18 plus items. And if you want to collect that for the mother versus the father, you have to double that. So survey researchers often don't do it very well because the measures are simply so long. We do sometimes I've been a part of studies where, in fact, we've had people sit together and talk with their kids on videotape. And then we have, graduate students and other people coding those things. But generally, it will be the report of somebody in the family.
Okay. And would you say, I know, you talk like a scientist, you sound like a scientist. I was surprised when you said you were quite eclectic when it comes to psychological therapy. I said, yes, I wasn't expecting for that one. But do you think, or do we have data, or do you think we have had some sort of change in I'm going to say, the prevalence of the parenting styles, or in general, there was a change over the past, say, 30 to 50 years
Yeah.
in the United States?
Yeah. I think none of us are immune to the, many, many news stories that come out saying, oh, spanking is very, very dangerous. You would kind of have to live with your head in the sand not to sometimes read these things and wonder, particularly if you are not a statistician yourself, how do you know if, this is good research or not? So, there was a recent study in Lancet in 2021 where, in fact, if you didn't know much about science, it's very impressive. They counted up, the many, many, many studies that had found a negative relationship between spanking and child adjustment. But if you go in and then you look closely, you find that much of the studies are not really measuring spanking. They might be measuring things like that all of us would consider abuse. They might be measuring. So in this sample done by doctors, they looked at kids who were 0 to 18, and you know, most of us, when we think of spanking a child, we're not talking about a 3 month old. We're not talking about an 18-month old. But if you include, 3 month olds in the sample, of course, these children are going to grow up with problems if they're being hit at 3 months old. And of course, if you're, using physical kinds of discipline with a 17, 18-year-old, of course, this is going to indicate some dysfunction. So there's a lot of things that, it looks very impressive, that, looked at, many studies. Actually, additionally, many of these were actually the same data. They had just been published by different authors over and over again, but if you are not really savvy, you're going to hear all the time that the spanking data, is really so conclusive and looks like spanking is so dangerous. But if you are kind of savvy and then you say, okay, well, let's look at the population where spanking might be appropriate. So, maybe after age 2, certainly not going into adolescence, but in kind of a preschool time, maybe early middle, childhood. Then the data can look quite a bit different. I'm going to do a conference. I'm going to American Association of Psychological Science conference this weekend, APS. And we're finding that when we look at studies that only use the word spank rather than abuse, basically we're finding no relationship between customary in-home limited use of spanking, with kids who the age for whom it would be appropriate, and their behavior problems. So, some of our data, we're saying, okay, look, we've got, if we have 24,000 kids, because we're doing a meta-analysis, so it's pretty easy to get significance with 24,000 kids, even if you have almost no effect at all, which we do. So we're finding that we can explain about 0.2% of the variance in children's adjustment, which is nothing. But so if we kind of look carefully at spanking studies, it's not there. But we're all, if unless you're a statistician, how are you going to parse that? So I think people are hearing these things. Oh, I lost track of your question. People are hearing these things, and yes, we're all being reluctant to spank. And I think it's good that we're reluctant. It makes us careful, but
Of
we don't want to
course.
go too far in the other direction.
Yes, and I think that's exactly what the problem is. You see, I have the podcast. I talk a lot about the shortcomings of the field, and I talk a lot about shortcomings with medication research, which is
Hmm.
it's quite something what psychiatry has become, and when I talk about these things out there, because pretty much every topic that I speak on as a monologue in my podcast, I test because I have
Yeah.
a lot of enterprise,
Right.
to see if it's where it goes, to see what the arguments are, so I can actually improve the thing and see the angles,
Hmm.
and present something that is fairly well thought through. It doesn't matter. Despite the effort, I heard at work 2 weeks ago, 1 week ago, that I'm a doctor who doesn't prescribe drugs. And that is not it. It's just that it sounds like we have become incapable of entertaining complexity. And we
Hmm.
have to go to, oh, you're in favor of spanking, so then, I don't know, Eugenie,
You must be abusive.
yeah, you're a monster. And
Right.
in the other hand, we have people putting this effort to say, don't touch. And that's why I was thinking, is there a change, and not necessarily with spanking, timeout as well seems to
Hmm.
be
Even timeout.
declining. And my thought is, do you think parents are trying to protect their children from negative emotions at the same time, which again goes for the joke my field has become, because uh, everything we do on a traditional way, the field in psychiatry, is we try these excessive numbing agents to
Yeah.
prevent any emotional turmoil. And as a patch on top of it, over the past maybe 10 years, we started to say mindfulness, which is completely like, no, either you accept what you're feeling or we numb it. But you can do both. We're okay with that. But, it's full throttle, both of them. They don't even walk hand in hand. And
Yeah.
so these extremes, let's protect this kid from. I remember in the 80s, I think, when I started to hear about don't say no to your children. I think that that was also something that came up in the I think in the 80s. And the thought I had, are we being handicapped as parents? Are we being handicapped by our culture as parents, with this new
Right.
formula? And what do you think? What you mentioned, one of the things that could motivate it being, awful data on spanking
Right.
or child abuse, which is immediately translated into, you know, don't touch the
Hmm.
golden boy, something. Do you see any other factors that could be playing in that regard?
Yeah, I think there certainly is, in addition to not understanding the research carefully, I think that parenting has just changed an awful lot. So, many of us, for example, working moms, we spend less time with our children. So, we want that time to be pleasant. And sometimes, even if we should punish, we might be inclined not to do it because we want the more limited time that we're spending with our children. We don't want to deal with the negative emotion. So we might give in, even if we know that's not exactly right. But a lot of times, people do think it's right. People seem to be under the impression that, in fact, children should not experience negative emotions, as you said. But I think that's a really dangerous idea. If you think about pain, sometimes we need pain to tell us that something is wrong and that something needs to be done, physical pain. And sometimes, kids certainly need some negative emotions to realize that they have hurt other people if they're feeling, convicted in their conscience, or if they just need to say, okay, I'm very, very frustrated, and I'm going to have to do something so this doesn't happen again. Negative emotions help us learn to avoid consequences. And so I think that we really sell our children short if we try to protect them from negative emotions. It's just not again, it's not preparing them for the world that they're going to need to inhabit.
That's beautiful. That makes complete sense to me. Um, One of the things that would you say there's a decline in spanking?
Absolutely. Yeah. And I think that's probably a good thing. That all of us, well, it's partially a good it's a good thing for many parents. I think many parents, spanking was the go-to response, and it should not be. Again, you should always use a less dangerous method if it works. You need to try those, non-physical discipline first. So I think it's a good and bad, but certainly we're seeing rates dropping in the United States as well, but certainly in Europe, some places it's prohibited by law, so certainly you're going to see less in those countries. But in the United States, we are seeing drops in spanking.
And how about is there a way to measure timeouts as well?
I haven't seen data on that, so I would be hesitant to say, but anecdotally, you do see on YouTube and those kinds of things, people saying things like, "Oh, I'm doing my best to practice positive parenting." It's this vocabulary that in fact has come into modern culture.
Yeah.
So anecdotally, I think there are people trying to do that for and again, it's the exclusively positive parenting that gives me the concern, whereas positive parenting in general, absolutely, I would like to promote that.
Yeah, it's kind of a chronic enabling process. Um,
Yeah.
so um, um, you mentioned something that I find very interesting. I said, "Oh, do you think there's a decline?" And you say, "Well, parents have less time, right?" And,
Yeah.
and a guy that I interviewed before, Bruce Alexander, he's the author of The Rat Park. He talks about addiction, and a lot of the things he said apply to what we do in my field. So, and he points out all these problems stemming from our current societal, let's say,
Hmm.
contingencies, right? We're always on the run. There's not a lot of time for the family. Really, things have changed drastically in that sense, which he refers to it in terms of dislocation, right? We don't have the social interactions, and he's not alone. A lot of people have been saying that
Hmm.
we're living unlivable lives in a sense. Um, but you pointed out then mom doesn't have as much time, and then when
Hmm.
she has um, the kid, you want things to be kind of smooth, and
Yeah.
and it's easy to um, either to feel guilty or overwhelmed by a tantrum or something like that.
Mhm.
And I know you wrote about this coercion thing. What's the name? Let me see. Patterson's coercion theory.
Mhm.
Can you explain that to us and how it
Sure,
plays in that
sure.
game?
Yeah, Patterson's coercion theory comes very much out of just general behaviorism. Behaviorism is going to say that if something nice follows what you have done, then you will do that more often. And if something unpleasant follows, then you will do less of that. Would be a simple way to state it. So, yes, if you have a situation, for example, where you're maybe you've got your child in the shopping cart going through, the market, and you're checking out, and there's some candy on the side of the, next to the checkout. And so your child starts to throw a tantrum. I want the candy. I want the candy. I want the candy. Okay. We have both at that point what we call positive reinforcement going on. If the parent gives the child the candy, the child learns that, hey, I threw a fit and I got what I wanted. So I'm probably going to be more likely to throw a fit in the future because it worked, right? But we also have what we call negative reinforcement going on with the mom or the parent. So, negative reinforcement means that something bad goes away, which causes me to increase my behavior. So, if I can get my child to, stop having a tantrum very quickly before I'm embarrassed in the grocery store, I learn that giving in stops the tantrum in public, and so next time I just do it more quickly. It worked last time. So both people are getting reinforced, both the child and the parent. And Patterson finds that as children learn that throwing a fit gets them what they want, they're more likely to increase the fits. And as parents learn that giving in stops the tantrum, they're more likely also to increase the giving in behavior. And you kind of get in this coercive cycle where you just move to that mode more quickly because, in fact, in the past, it has sort of worked, if you will, worked to solve the problem in the short term. Now, obviously, this is very poor parenting in the long term, but it saves you the embarrassment in the grocery store, so
Fair, fair,
yeah.
fair. Um, we have talking, about this progression of parenting styles. I've been so I finished psychology 20 years ago, different country. Then I finished my residency in psychiatry here in 2016, and it's too small of a window for me to have a personal impression of these things. But talking to people that have been on the field for longer, it seems that there's a general impression that behavioral I want to say I'm going to call behavioral problem. Okay, as I said,
Mhm.
I'm more interested in the semantics than the politically correct
Okay.
stuff. There seems to be an increase in behavioral problems of in childhood, and I not as much from a personal perspective. I have data from a diagnostic perspective, but the limitation we have with diagnosis is that syndromic diagnoses are not that consistent, and there's a huge overlap. I can give you, for example, one example. So if you take, for example, the concept of functionality from Skinner, and you look to the criteria diagnostic for ADHD, you have virtually inattention and psychomotor agitation, and you have a bunch of correlates, a bunch of observable behaviors that will represent inattention, and a bunch of observable behaviors that are all the same thing as psychomotor agitation.
Okay.
Now, the challenge we have with that is that psychomotor agitation and impairment in attention are also symptoms of other syndromes like generalized anxiety disorder, major depressive disorder, and God help us, bipolarity, mania. So we have the numbers showing the increase in those diagnoses in childhood. Um, Between in the last decade, the diagnosis of bipolar disorder had a 40-fold increase in visits to the outpatient settings and in prevalence. And that people attribute that to a Dr. Joseph Bitterman, who's deceased now, but he was heavily financed by pharma
Yeah.
on his work. And of course, the damage is quite scary. We're prescribing Risperdal to children. Do you see on your field also that? Do you have that impression from a clinical perspective? Because I don't know, we are too bound to diagnosis. You never see a kid go to an appointment with a shrink and come back, go home just saying, I'm going to use one of those vehicles or something. We don't even use those things. You're going to receive a stamp, going to receive a stamp with a drug. But my hopes are that psychology are a little bit less stuck to those rules, even though the billing needs to happen. And that you can actually look to behavioral problems from a contingency perspective, from a relational perspective, systemic perspective, and then give whatever name it needs to have as long as the kid doesn't get hurt. Do you see an increase in behavioral problems in kids?
Again, I'm not a clinician. I'm a developmentalist. And so I actually don't know the data on that. I do know there is data suggesting that the treatment programs for kids with problems are about half as effective as they used to be 30 years ago. So this would suggest that probably behavior, at least if they're not, if it's not new cases, it's at least persisting longer or being more serious, because we are seeing the treatment programs that were very behaviorally oriented with consequences. Those do not seem to be as effective. I think also, just theoretically, there are a lot of us who have concerns that children are not learning the skills that they need to learn, because, in part, of a changing society. So if you think about the fact that, many kids used to need to work in the fields, picking crops to help their parents, right? And so by 8 or 9 years old, they were learning that they were making a real contribution to the family. They were learning that, yes, it was hot and the work was tough, but they were learning that they had grit and they could do it if they needed to, right? There were things that and even if you're not working in the field, you had to hand wash your dishes. There were things that, just had to be done around the house. People had chores, they had to do them. They learned to do schoolwork, to push on. You learn things. Bandura calls that self-efficacy. Do I learn that if I work hard, I can in fact achieve something? And I think we're at a place culturally where kids don't get that experience anymore. So if we're a double income family, sometimes we make the kids mow the lawn. Sometimes it's easier just to pay somebody because there's no fighting. It gets done. Pay somebody else to do it. And so we let our kids hang out online, getting kind of this immediate gratification, and they never learn. Many of them never learn, hey, I'm learning something about myself. I'm learning that I can, in fact, have grit and persevere if I have to. We kind of rob them of that opportunity when we don't require them to work around the house, to persevere at tasks. And some of that is just, I think, parenting laziness, because it is, quite frankly, easier. We're pressed for time. It's easier to pay somebody else to do it rather than make our kids learn the skills and also learn about themselves, that they can accomplish those skills and make contributions to the family.
I was not anticipating this interview going this direction, but you see, we have a meta-analysis showing that CBT is losing efficacy compared
Okay.
to the seminal studies is like really
Okay.
dropping.
Like with adults or
Yeah,
just
with
in
adults,
general?
with adults,
Okay. Okay.
and I haven't, because you see, I'm not a scientist. I'm a
Mhm.
thinker. I read about things. I'm very
Yeah.
eclectic as you are, and I get to think about problems, and I get to change the way I practice, and influence the way of a lot of people that I work with practice. I have a mentoring institute and things like that. So,
Mm-hmm.
and I get to run things, and people get back to me and say, "Oh my God, I saw this thing happening." So it's more of a clinical approach kind of thing. But one of the thoughts I had was that in our society, personal responsibility is something that is in clear decline, right? Everything from probably from a political perspective, everything's somebody else's fault, and it's preyed upon. This
Mm-hmm.
concept is preyed upon, and there's this constant fight between people thinking this extremist, this black and white thinking about every single problem, and one of the things that I considered in this episode was, we have the concept of locus of control, which
Right.
which is personal responsibility, just
Mm-hmm.
translated into fancy
Mm-hmm.
words. Um,
And think about how, I'm sorry to interrupt.
Please.
Think about how this has been confounded by COVID. So I think that I'm finding many of the college students that I come in, that I teach, the recent cohorts have just learned that they're helpless, and they were in fact helpless when the whole world shut down. And so I think many professors I know are talking about how we're seeing kids at this point who lost the last couple of years of high school, who just don't have the grit. Not all our students, some of them are still fabulous, but many of them just don't have the grit to make themselves write the paper. And it just seems as though we're seeing very, very high rates of learned helplessness.
Wow, that is so
But I
interesting.
interrupted you. Sorry, you were going in
No,
a
no,
different
no.
direction.
That's no, no, no. That was exactly where I was going. Is really this thing being taken. You know, uh, it's a cultural change where everything
Mm-hmm.
else is needs to be provided or given by somebody else, and
Mm-hmm.
um, and I think is also it makes sense. And I'm thinking this amalgamation of things that I've been learning from folks that I interview is, yeah, the societal changes, it really forces the hand of. Now, is there any data considering that we are struggling, right, with probably both things? We're struggling to be authoritative parents
Mm-hmm.
because we don't have maybe enough emotional availability as we would like to
Yeah.
have, and we don't have, which maybe you're going to say, well, I spend my whole day away from this boy. Now he's misbehaving. It's probably not his fault. And what can I expect from him? It's on me. And then we also fail to uh, sustain the consequences, because after all, I took the Saturday to be with my son so we can play soccer or video game or whatever we do together,
Mm-hmm.
and he's behaving, and I should just call it off and remember that my job as a father comes first, whatever price I have to pay to raise this little boy. Sort of a archetypical Mary, right? My son's going to be crucified, and my job is to still throw him in the world ready for it. Uh, an exaggeration, but um, is there any data showing that being trained in parenting styles, or
Mm-hmm.
adopting it, increases the proximity, the affective part that it seems to be so important, that seems to be more important today than the preparedness of a child for the world?
Let me clarify that question. Are you saying what's more important, the childlike emotionalness or their preparedness, or just is there data?
Well, I think what I was trying to say is that it seems that now protecting my children
Okay.
from negative emotions is more important than having ready for life,
Hmm.
and
Okay.
live a meaningful life. But
Right.
I guess my question is, do we have data saying, okay, training someone in the sort of adjusting the style,
Right.
will that result in this more appealing result of this connection, this emotional connection is part of the package, so people
Hmm.
have some hope?
Hmm. Um, most most parenting programs do, most of them that are evaluated, which is a problem because many people start out with the great idea of a program, but they don't build in an evaluation component. So, but most programs that are evaluated and developed at universities, those kinds of things, will usually show that parenting improves, it's kind of regardless of what in some ways, regardless of what you're teaching them. It seems to be helpful for parents to meet together with other parents, for the parents to get to support, to share ideas. But the systematic training is, of course, very, very helpful. Just training kids, training parents to be consistent, training them to respond emotionally. So training, I think, is very good. And generally, we will find that good programs will, in fact, show some improvement. But I don't want also to be too, it doesn't always, usually you can get some effect pretty quickly, but it won't necessarily come real quickly for many children. So if you've got your most difficult cases, particularly if they've come from a situation of like early neglect in my international adoption research, in those cases, often changing the parenting may not do a lot to rework some of those really early learned self-protective tendencies. Sometimes things that work with reasonably healthy kids can, in fact, even just backfire with other kids. You might say, hey, I spend more time with you, but the child is so scared of letting down their emotional guard that as you show them more love, they may actually block more and sort of emotionally block, and try to almost do things to make you mad, you might say. So yeah, so training is big, but there's also just a lot of psychodynamic stuff I think going on from infancy with attachment theory and things that make training not always effective with some kids, at least not in a short term. I mean, often we can see attachment problems heal over many, many years, but it can be a very long road.
You mentioned this research of yours about
Mhm.
adopted children and what you described as inattentive overactive syndrome.
Mhm.
Um, can you develop on that? Because you see, from a syndromic perspective, we understand ADHD
Mhm.
as a collection of traits.
Mhm.
And that's one of the reasons that so far, it seems, DSM, the task force, which I think it's probably a lost battle, but has been resisting including the adult onset ADHD into this package
Okay.
because really, who can focus after you turn 25 and get a job, right? It's just it's just the lack of critical thinking in the field is shocking. But there's this effort. There's three big papers, and when you read about it, they're quite. I read two of them, and I think
Okay.
there's only so much left I could have. But it to differentiate, right? And the challenge, of course, in differentiating is that anxiety also exists as a trait, not only as a state.
Mhm.
You can
Mhm.
you got to compare, of course, to come up with that and say, well, some people are just seemingly more anxious than others,
Mhm.
and then there's the state of anxiety, which is, of course, almost a synonym of being an adult these days. Um, but we look at it as traits that people are born with, and from a biomarker perspective, so far, ADHD has failed, research on ADHD has failed to produce reliable biomarkers.
Okay.
That, they come up, there was a bunch of different brain changes and things that, enthusiasts of the field like to believe, but then small studies show, well, not that consistent, and then they don't have replication for the most part because it came from a time where we had only a huge publication bias, so to speak. And,
Okay.
and when you look more attentively, we don't have those biomarkers for ADHD. And then you describe this, and the other thing is that we don't have etiology when it comes to DSM because it's all topographical descriptions. We're really not looking to, except maybe for PTSD. And but then you describe this inattentive overactive syndrome that is associated with institutionalization in early life.
Mhm. Mhm.
Can we tell there's a difference? Is ends up being the same thing? Like I'm not. I don't have any doubts that a shrink is going to look
Yeah.
to a kid like that and say ADHD and here's your
Mhm.
stimulant, which has its role. I don't oppose drugs as some people may believe. But what is it? Can you tell me what is this inattentive overactive syndrome?
Yeah, I think um, in that paper, I'm actually the second author on that paper. But I think we were simply just using, your traditional standards for ADHD, probably more than trying to say this is a syndrome. We were simply making the point that that attention problems are very, very high in your post-institutionalized populations, particularly if it's when they were young. So I guess a way that I like to think about it is that the brain is so high in plasticity when we're babies. We have to remember that genes hardwire in what we call critical periods, so times when the organism is supposed to take information about the environment and then tailor the brain development in a certain direction. So, for example, if I am a baby in a very secure, safe home, then I'm going to take that information that my world is reliable, and I am going to, sort of develop my brain in such a way that prompts me to trust the person that is so reliable in my environment. Okay. But if I am in an environment where things are very dangerous, then my brain is actually going to develop in a way that makes me much more alert, much more kind of anxious, vigilant, etc. So if we look at kids who come from unsafe populations, whether that's an orphanage, whether that's a high abuse situation in a home, unsafe very early in childhood, we find that these kids are, in fact, their brains are developing in ways that kind of give them um, very, you might think of it as sort of scanning the environment, noticing things. Their bodies can't relax, but they're very vigilant. So there's actually some research suggesting that the brain actually sacrifices language development for kind of this visual scanning development. So I am just constantly looking around, potentially noticing things, and the whole brain is kind of the neural network pattern from the limbic system up to the frontal lobe actually just looks much more diffuse. So rather than like a highway where that might let me sustain attention, the branches get very spread out. So any little thing may cause me to notice it and be distracted, right? So that's very maladaptive in many environments. But if in fact you are in an environment where you have to notice any little change that could bring danger, then it's kind of adaptive for the environment that you were first in, even though it is not adaptive if you were to then get in a stable environment where you might prefer to have language skills over this visual scanning tendencies. So I think so yeah. So is that the it's I don't think we would say there's really a syndrome per se that goes along with this early deprivation, but we would say we're seeing many of the same kinds of things that fit kind of a typical ADHD pattern where you see that those diverse pathways and those kinds of things.
I love what you just said. We have one challenge we have in child psychiatry, and which is usually it's evidenced by adult psychiatry. So I have worked in different settings, and some of them very tough places with people with tough stories and stuff. And I'm naturally very skeptical about everything. And what happens is people come to me and I'm listening to their stories, and they say, "Well, I was diagnosed with ADHD when I was 9." Okay, and via specific interview strategy, you end up following a specific sort of, I would say, script for the interview,
Okay.
which kind of involves a sort of a gradual warm up of in terms of depth and what people are going to disclose. What happens is that there's this huge number of patients, and by huge I mean it, that will tell me things like, "I never told this to anyone, but when I was 8, my uncle touched me funny," or something, or so, it's always something very unbelievably painful. And within a year, that kid starts having behavioral problems in school,
Right.
doesn't focus anymore, is always, on edge. And obviously we're talking about a trauma-related diagnosis, but the kid obviously ends up with a diagnosis of ADHD. And and because of that flaw that we have, we end up giving this stimulants. They're quite a shut up medication when it comes to, which is makes me question the ethics of what we do for a living.
Yeah.
And I never saw in my training, despite the question being in my mind, because I'm not a child psychiatrist, I have a limited exposure, but I never saw a case come as a referral for ADHD. I never saw the diagnosis be refuted, not once, which means the diagnostic capabilities of everyone that has internet and Google at home is the same one as the psychiatrist. And you can imagine how popular I am for saying these things. And the other one is I never saw a story of abuse being caught. Does that make sense? So we are really looking, based on what you're telling me, we may have a presentation that resembles ADHD because of the inattention and the restlessness, but a traumatized kid should be inattentive and restless, because at the end of the day, being neglect is a sort of a trauma in my book. And so I'm very fascinated with this explanation you just gave, because we have that real problem. People get diagnosed with ADHD regularly after becoming victims of trauma. And obviously, it's going to take another 20 years until these people can actually go back and say, well, by the way, this is what was happening to me.
And I'm not sure that diagnosis is inappropriate. So again, I guess I think a little bit. I'm not a clinician, but I don't think. Um, unfortunately, I don't need actually to distinguish people's syndromes. I'm saved from that. As a researcher, I simply kind of count up symptoms, and do you meet criteria for this? It doesn't necessarily even. So in research, might not say, oh, this is per se a syndrome. We're just saying,
Right.
hey,
This is what you're
are they showing
presenting. Yeah.
elevated symptoms? Right.
Yeah.
But I mean, if you think about the fact that, I mean, in developmental psychology, we often think of ADHD as really, or I should say, maybe not ADHD, but attention problems as being just one of the most common responses to bad childhood things happening. I want to be careful because there's a lot of children who have attention problems who have not had stress and trauma kinds of things. But, but that kind of pattern of brain development just seems to be very, very common. It's just kind of like a more of a generic response rather than a syndrome. I think just a generic response that you're going to have attention issues if you've got past trauma, those kinds of things, or current stress. I mean, no matter what we look at, whether we're looking at, child abuse, divorce, poverty, no matter what we look at, we're pretty much finding higher rates of attention problems. And that's sort of why we say it just seems to be kind of, if there are many things that cause a runny nose, okay, that's just the body's natural response to many different kinds of things, whether that's a virus, whether that's allergies, so, and I think it's kind of like that. The brain will sort of develop in a way that makes it a little bit inattentive in response to stress. So I'm not sure I would have so much problems with the diagnosis. And I'm not even sure necessarily that time will fix. I certainly would say you certainly want to address that trauma with talk therapy and other kinds of things. But given that if this may have happened very early, the brain may in fact have laid down a pattern of pathways that even once you've worked through the emotional component of the trauma, the brain is still going to kind of automatically follow those pathways, and go in that sort of direction. So I guess maybe in contrast to you, I have less problem with the diagnosis because it may in fact be appropriate, but it may or may not be related to trauma. And, so I would kind of favor treating the child on multiple levels.
Yes.
certainly if you can help them, and if talk therapy is sufficient, that's great. It's just like spanking, use the less intense, invasive kind of technique first, see if it works. If you initially need to go to something else, like some medication. I'm kind of ambivalent about ADHD medication myself. I certainly know people who claim that it helps them tremendously. It helps them, develop self-efficacy, like I talked about. If the child feels like they can't do math, but then they are given some medication that helps them realize, oh, I'm smart enough to do math. All of that impacts the view of self and all those kinds of things. So um, I usually encourage parents, try a lot of things, but see what works for your kid. Is
Yeah, the medications, it's an interesting topic because, and you're right about the diagnosis, because really DSM doesn't take, our criteria doesn't take into account anything other than the topographical description.
Yeah,
But
yeah,
the limitations we have is that if you look into the diagnosis of ADHD, it is contained inside the diagnosis of generalized anxiety disorder. And not being contained in PTSD is just arbitrary because that's how the DSM was put together. People just sat
okay.
together and came up with the decisions. It is just a topographical. We can have as much as 5 diagnoses to explain one thing. And who cares whether
Right.
we are trying to help people to just go through life. The thing about meds is because we already know we're not fixing anything in the brain,
Yeah.
and because we know they all develop tolerance. It's a common tale that people start taking medication, report some change that can be beneficial, or as I like to treat in terms of a desirable impairment.
Right.
And within a month or two, they come back and they need a higher dose. And that with the stimulants is, benzodiazepines, the same thing, is very clear. There's an escalation of
Yeah.
because we prescribe chronically, when
Yeah.
maybe we should just say, okay, what's the task at hand? Let's address it.
Right.
But that discussion is it's on fire everywhere at this point. But you mentioned the medications as well, and we exchanged a few emails before about the
Hmm.
mortality on,
Right.
yeah, and so that paper, the paper on the mortality of antipsychotics, because
Mhm.
this is what happens. In another episode, I said I was talking about childhood bipolar, and I said that we as a profession, we came to believe that prescribing Risperdal is more humane than spanking.
Yeah.
And,
It's
and you can imagine, right? So a lot of people applaud and a lot of people, get their torches and their
right.
pitchforks and they come to
Right.
kill the monster. And but of course, it's because people cannot entertain complexity these days. I'm just trying to say, hey, just look into this thing. I'm not saying
Right.
please spank your
Right.
children.
Right.
I'm saying I would spank my child before I'll give him Risperdal.
Yeah.
And the way that paper was done, the one I sent you, is because it's very difficult to measure these things. They pretty much got, I think, roughly, I don't remember the numbers now, 40 people. That paper I already had, but I forgot the numbers now. Where
What you sent me, I think 45 out of
Yeah, 45.
10,000,
Yeah,
was
that's the comparing kids on medications versus
Hmm.
kids on medications that include antipsychotics,
Okay.
because they all, if like they have deaths on both sides. Stimulants also
Hmm.
have a lot of deaths.
Hmm.
But then when they compare the antipsychotic, the addition of antipsychotics above a dose that is equivalent to 50 milligrams of thorazine, which is pretty low, you have an excess deaths in this group of 45
Yeah.
per 100,000,
Yeah.
while the general rates of death by neglect or abuse are 2.5 per 100,000.
Hmm.
And even if we take, I wish to be perfect this comparison, we would have to find the mortality of kids by neglect and abuse, kids that are in psychiatric care, because
Yeah.
they are more, they're more active, they are probably more
Right.
stressful for parents that may be ill-equipped. And but I truly, that was something I truly doubt
Yeah.
would reach 45 per 100,000.
Yeah. Yeah. And I should clarify, I would certainly like to see changes, better parenting before I would put my child on medication. I think often sometimes in class I'll get students say, well, how exactly are these medications work? And I have to say, well, we don't really know. Write this down um, because sometimes we think we know how they're working, but it just, again, I'm not a medication expert, but it just seems like there's so much going on that we're not understanding yet. I'm not a person who jumps quickly to medication. I certainly would, entertain it as an option if other things have been tried, but I'm one of those people who, you know, I don't go get a henna tattoo because I'm scared of the chemicals. I just, in terms of kind of infant teratogens and brain development and those kinds of things, I'm very, I do whatever I can to avoid chemicals really of any kind. So,
Absolutely.
um,
And
yeah.
and my last questions for you will be, um, for our listeners that are that work with kids or with
Mhm,
parents that have kids,
mhm,
and would like to be more uh, maybe trained or informed on
mhm,
parenting styles, and especially how to coach parenting and that kind of stuff. Where can
mhm.
we find these resources? Do you have any specific recs, readings, whatever?
And yeah, I mean, I think if you search things by Diana Baumrin, she's got some pretty good articles on parenting. She's deceased now. Um, that's a great question. As I was trying to think, what you emailed me was where could they find like training programs, and I
Yep.
was going to say if you're interested in what's called parent-child interaction therapy, so PCIT programs, that's kind of state of the art now. And if you just search find a provider for PCIT, there's an international, a national directory. Now, I will say PCIT now is they will train you to systematically put your child in timeout. They do not use like the backup spanking that was so effective in the 60s to 90s. But my understanding is that they still seem to get improvement. So I think I feel pretty positively about these training programs in general. I mean, being systematic and consistent is going, and giving your child some consequences is going to go a long way for many kids. So there's certainly that available. If you're looking for things to read, boy, that's tough because it's hard to sort through, what's good and what's just ideological. Um, I generally like things by Baumrin. I like things that my own team has written. If you search Gunnoe and Lars Lear is someone I publish with quite a bit. I think I really kind of think of him as one of the most sophisticated statisticians in terms of discipline kinds of things. He compares different kinds of consequences. So those are good. But really, even just like a developmental psychology textbook, you could, if you get an old edition, sometimes you can get them for, under 10 or $15. If generally, I find just more developmental knowledge of children will often go a long way as well for parents.
Perfect. Again, Marjorie, thank you very much for accepting my invitation. It was a lot of fun
Oh,
discussing
thank
these
you. It's been
topics with
fun.
you. And please keep in touch.
Okay.
All right?
Yes, good. Very good. Thanks, Rod.